I'm Dr. Watts for Biogenetics, and welcome back to the Perfect Pairs series once again. This Perfect Pairs series is all about BioG-Max B12. BioG-Max B12 is one of those nutrients that we have wrapped in a liposome to increase the cellular uptake, utilization, and obviously the effectiveness. In the Perfect Pairs series, I've been telling you about the different nutrients I like to pair together with BioG-Max B12 in different healthcare situations. In this specific video, I want to talk about chronic kidney disease. Chronic kidney disease is one of those things that ravages patients. Sometimes they're diabetic, sometimes they have autoimmune conditions, sometimes they're just obese and can't detox. Whatever the cause, chronic kidney disease is not something to take lightly. It's often what I call a rate-limiting step in a patient getting better, meaning they're only going to go as far as their kidneys allow them to, especially if they're using diabetes medication, especially if they refuse to drink water, and especially if they have a terrible diet. One of the things that I found over the years that contributes to chronic kidney disease is the presence of a chemical called homocysteine. Homocysteine is vasoconstrictive and vasospasmodic. And because the kidneys are basically a collection of vessels, you can imagine how important it is to control homocysteine levels. Remember, when an artery is constricted, the pressure is gonna go up, and those kidneys are sensitive little buggers, and you gotta take care of them, you gotta love them, you gotta give them a little TLC every now and then. So when you see increased creatinine, increased blood urea nitrogen, or even decreased filtration rates, it's time to look for reasons why. Look for that homocysteine number, it's gonna be high. In the last Perfect Pairs video, you learned that BioG-Max B12 can act as a methyl donor, where we take a methyl group and we attach it to homocysteine so we can get rid of it through that liver detoxification pathway. In no case is it more important than in a kidney case to get rid of this excess homocysteine. These patients are often on a truckload of blood pressure meds, sometimes on the list for dialysis, and almost always freaked out of their mind because nobody's offering them solutions. Now, in these chronic kidney disease cases, I usually like to pair BioG-Max B12 with something called BioG-Max PC. It's phosphatidylcholine. Phosphatidylcholine is essentially cell membrane, just like the cell membrane of your kidneys. When you implement cell membrane therapy with phosphatidylcholine, it has a similar mechanism of action as rehydration. Those cells plump up, the cell membrane repairs, and you start to see cellular integrity returning. What that looks like on a lab test is increased filtration rate, creatinine levels that are going down, and a patient that's looking pretty positive. Well, chronic kidney disease is obviously multifaceted and usually very complex. Sometimes all it takes is a little proper nutrition to get the ball rolling in the right direction. Be that person, be that provider, be the one that sets that in motion. Pair BioG-Max B12 with BioG-Max PC. Pretty amazing what can happen. All right, thank you once again for watching this Perfect Pairs video. I'm Dr. Watts for Biogenetics.